Alright guys, we're going to get started with today's chapter, which is chapter 2. It's called the Medical Assistant and the Healthcare Team. Now this chapter is going to get a little bit into the history of medicine and also what to expect as a medical assistant in the administrative setting. So some of the objectives we're going to talk about today are going to be to go over the vocabulary words, be able to define, to use them, to spell and pronounce them as well, all the vocab words. We should summarize the history of medicine, as I said earlier, and its significance to the medical assisting profession. So how did the history of medicine help shape the medical assisting profession? Okay, we're going to identify national departments and agencies that focus on health. We're going to list professional medical organizations as well as discuss typical job descriptions of a medical assistant and describe your role as a medical assistant as the patient navigator. All right, then we're going to talk about identifying a variety of allied health professionals and who is exactly a part of the healthcare team and where we can see ourselves in a medical field. We're going to summarize various types of medical specialties and healthcare facilities. We'll talk about patient-centered medical home, or PCMH, and discuss its 5 core functions and attributes. And then we're going to be able to differentiate between scope of practice and standard of care for medical assistants and compare and contrast the provider and medical assistant roles in terms of standard of care. Now that scope of practice, guys, that's important to pay attention to these slides because that is going to be over your assignment where I'm going to ask you to locate a scope of practice for your state that you currently reside in. Okay, so let's start with the history of medicine. Okay, so it goes way back to Moses. Okay, presented the rules of health to Hebrews in approximately 1205 BC. Okay, so that's over 3,000 years ago. Okay, well over 3,000 years ago is when Moses presented these rules to the Hebrews. Okay, and then Hippocrates is a well-known figure. Okay, he's known as the father of medicine. He was the one to really get it started, and he is the one that is named, the Hippocratic Oath is named after. Okay, now the Hippocratic Oath is still used today all the times. For most graduating students, whether they come out of a medical school or something along those lines, they swear to that Hippocratic Oath that is named after Hippocrates. One of the earliest academics was the Royal Society of London. It was formed in 1662. Okay, that was like one of the first medical schools. That's where you went and you learned the anatomy. Okay, you learned what was going on. Now, of course, it wasn't as advanced as today's medical schools are, but it was the first. Okay, Johns Hopkins University School of Medicine. That was in 1890. That was a unique one because Johns Hopkins University worked with Johns Hopkins Hospital, and they combined to give them the real hands-on experience as medical students. So that was the first time you've seen that setting there. Now let's get into some of the departments that we are going to be dealing with a lot in the medical field, and you'll hear about all the time. In the United States, these agencies primarily focus on health and safety in the workplace, so they're important to know. The Department of Health and Human Services, DHHS, okay, it's the principal U.S. department for providing essential human services and protecting the health of all Americans. Okay, that is their job, their function. The Center for Disease Control and Prevention, or the CDC, is the principal federal agency concerned with health. All right, CDCs, you'll hear that all the time. They come out with all these warnings about different health regulations. Okay, they're the ones that deal with primarily health. Then you have the National Institutes of Health, or the NIH, and is the part of the public health service that seeks to improve the health of the American people. So they're the research people. They're the ones that dig in and they try to find the best ways to promote health to Americans. Okay, and then you have OSHA, which is the Occupational Safety and Health Administration, and they're a part of the Department of Labor that is responsible for enforcing regulations to protect individuals in the workplace. So these guys are really worried about workplace safety. Okay, so those are the main general agencies, the federal agencies. Now we're going to talk about professional medical assisting organizations. So we're getting more specific to the trade that you guys are learning today. So one of them is the AAMA, or the American Association of Medical Assistants, and it is the only association devoted exclusively to the medical assisting profession. So the AAMA is the only group that is specific for medical assistants. Okay? In 1993, the accreditation process was reconstructed or restructured and became the responsibility of the CAAHEP okay, which is the Commission of Accreditation of Allied Health Education Programs. All right, so all health education programs have to be accredited by the CAAHEP, okay? So only graduates from CAAHEP accredited or accrediting bureau of the health education schools, accredited schools can sit for national certification exams to become certified medical administrative assistants, okay, through the AAMA. All right, since we here at Job Corps, we are not an accredited program, okay, so we offer the Certified Medical Administrative Assistant exam, the CMAA exam. So we have the American Medical Technologists, or the AMT, and that was founded in 1939. It is a nationally recognized organization or certification agency for multiple allied health professionals. And then you have the NHA, that is who we go through. That is our organization that we are involved in. National Health Career Association is not involved in the program curriculum standards or program accreditation, but it was established in 1990 to offer these other examinations for other allied health professionals, and that is what we use here. We use the NHA's Certified Medical Administrative Assistant exam at the end of all these courses. So what to expect on your job? You know, what do medical assistants do? Okay, medical assistants are the only allied health professionals specifically trained to work in ambulatory care centers. Okay, that means they can walk in, walk out, and do those types of things. All right, so these trainings include clinical and administrative skills, and they cover a multitude of medical practice needs. Here in this class, we just focus on the administrative aspect of that. If you wanted to continue your education and go further on, you can look at 8 ACT programs, such as NMCC. There is the medical assisting program, which you get the clinical side as well. So all graduates of accredited programs are taught a similar skill set, including clinical and administrative skills. Here, like I said, we only focus on the administrative skills. So some of those administrative skills, okay guys, that could be anything from answering telephones to managing patient scheduling to creating and maintaining patient health records to documenting accurately in a chart to managing patient scheduling, performing basic practice financial procedures, and performing procedural and diagnostic coding. And that's all stuff that we are going to cover, guys. So we are going to get all of that throughout this course. So the medical assistant as a patient navigator. So Dr. Harold P. Freeman back in 1990 developed the concept of patient navigation. Okay? And basically what this is the medical assistants play a significant role in being the patient's advocate. Okay, so data from the Navigator program shows that they can improve the diagnostics of cancer and treatment outcomes. So the Affordable Care Act requires that insurance navigators be available to help consumers reach and enroll in health insurance through the laws of health insurance marketplace. So we kind of help navigate these patients to set them up for the best care possible. So here are many different types of allied health professionals. So these allied health professionals fall into 2 broad categories: technicians or assistants, and then nurses or therapists. Okay? So if you look at table 2.2 or 2-2 in your book, you can see all the health occupations recognized by the AMA. Okay? So here are just some. Here you have nurses, respiratory therapists, radiation therapists, occupational therapists, physical therapists, technologists of various types. Technologist is another name for assistants. You have dental hygienists, medical assistants, which is what we are going for, phlebotomists, pharmacy techs. So there's a bunch of them, guys. So the medical assistants are an integral part of this team. All right, so the allied health professionals typically work as part of that team. And like I said, those medical assistants are a huge part of that. So allied health professionals comprise nearly 60% of all healthcare workers. All right, nearly all of those people that we just listed on that last slide, they make up 96% of the healthcare field, which is a crazy amount. 5 million allied health professionals work in more than 80 different types of professions. So the healthcare field is huge. There's many opportunities out there for you guys. You just have to find your field and what you really truly want to follow up with. But 5 million workers out there in the United States in more than 80 different types of positions. Okay, so most generally, the end-all goal is to become a doctor. You know, all little kids dream of being a doctor one day. And it's the most widely recognized, okay? So with a doctor, you're able to write prescriptions, perform surgeries, diagnose illnesses and diseases, but you have to specialize. So to become an MD, it usually takes 4 years of undergraduate training and then 4 years in medical school. And then you can specialize in certain fields to take another 3 or 6 years. So at the shortest, you're looking at 8 years to become a doctor. The longest, you can be looking up to like 14 to become a specialist in a a certain type of field. And all doctors must be licensed. Okay, some of these classes that you'll be taking or you could take would be like biology, physics, organic and inorganic chemistry, math, English, humanities, social sciences. Those are all like pre-med classes in the undergraduate students. But students may participate in a 3 to 8 year residency to help along with this process. So if you look at table 2.4 or 2-4, you will see some more examples of medical specialties or specialists as well. So doctors of osteopathy or DO, okay? They use surgery, medicine, or OMT. And OMT stands for osteopathic manipulative therapy, okay? And basically that is just getting in and manipulating the body. So Andrew Taylor Still is considered the father of osteopathic medicine, and he founded the American School of Osteopathy located in Kirksville, Missouri. Fun fact. Okay, pre-med students moving towards osteopathic medicine study biology, physics, inorganic chemistry, and organic chemistry, mathematics, English, humanities, and social science. Same thing as all pre-med students, okay? DOs, okay, which is Doctors of Osteopathy, DOs is the abbreviation. DOs participate in a 12-month rotating internship with various specialties areas before entering a residency program that lasts 2 to 6 years. And they are eligible for the board certification through the American Board of Medical Specialists or the American Osteopathic Association. Many DOs believe that the body has the ability to heal itself, so they use conservative medication use in their practice, and they try to look at it a holistic type of view. So the doctors of chiropractic, they more focus on the nervous system, okay? Because the nervous system controls and coordinates all the functions of the body. You know, breathing, swallowing, walking, thinking. That's all the nervous system, okay? So that's what they focus on. And what they want to do is they want to remove distortions or disruptions in the energy flow within the body, okay? And now these people can work in a specialty or in a general practice, but there's still things. So chiropractic college usually requires undergraduate studies of biologies, those chemistries, English, physics, humanities, and then 3 to 4 years just studying straight chiropractics. Chiropractic is one of the most common fields and is complementary to an alternative medicine. Chiropractic can be used along with both allopathic and osteopathic medicine and to enhance the results of treatments in itself. So this should be used as a supplement to many things. And then you have hospitalists, okay? Now, although the hospitalist is in charge of the patient while they are in the hospital, hospitalist is a little bit different, okay? So they are in the medical care of hospitalized patients. They're employed by healthcare facilities, and what they want is they just want a good quality of life. These guys, they work a set number of weekly hours. They are salaried, so regardless, they're getting their paychecks. So that if that's the type of security that you would like to see in your job, and you have high ambitions and goals for yourself, really look forward to this. That would be a good field to enter into. Dentists, okay? There's a couple of them. There's a doctor of dental medicine, or the DMD, or you have a doctor of dental surgery, or a DDS. Both of them, treat and prevent gum and teeth issues, and that would be more so the doctor of dental medicine that does that, while the doctor of dental surgeries will perform oral surgeries and write prescriptions. So some dentists perform straightening called orthodontics, while some others perform root canal therapies called endodontics. Okay, so there's many different fields even within dentists. So dental school usually lasts 4 years after completion of undergraduate studies, and then you have to take a state licensure exam. Okay. There's optometrists and podiatrists. Okay, so optometrists, they test the visual acuity and treat vision defects. Opt means vision or eyes. Okay, so optometrists, that's what they deal with. They often give out correctional lenses or glasses, and you have to be licensed by the state. So optometrists study at accredited schools of optometry for 4 years after completing undergraduate studies in science and mathematics and English. Okay, optometrists should not be confused with ophthalmologists, who are licensed MDs or doctors of medicine. Okay, so ophthalmologists are licensed doctors, while optometrists just deal with giving correctional lenses and those types of things. Podiatrists, on the other hand, they're at the other end of the body completely, care for feet. Okay, they look to find pressure points, and they deal with weight distribution problems. Okay, podiatrists train for 4 years at accredited colleges of undergraduates studies in the sciences. So they really focus on the science core classes there. And then you have nurses. Okay, this is, we do offer the gateway to this field. We have the ACT program at NMCC that will set you up to become, a nurse or an RN if that's the field you want to go to. So nurses usually find a specialty area that they enjoy and practice within that area, although they may also float from different departments within the hospital. Okay. So basically, they provide basic patient care services. You have to have advanced training beyond the RN degree. So here we offer that RN degree, but they have to be beyond that. And they are licensed by the individual states. So some function as home health nurses, visiting patients and providing home care, while others work in nursing homes, in public health, or in physicians' offices. So practical or vocational nurses often work in hospitals or skilled nursing facilities and are also often found in physicians' offices. They sometimes supervise nursing assistants and may provide patient care to those services. So we do send a lot of students to the ACT program through this, and that is a great thing. So a nurse practitioner is allowed to practice independently or as part of a team of not healthcare professionals. Then you have nurse anesthesiasts, okay? And basically they are RNs who administer anesthesics to patients during surgical or inpatient diagnostic procedures. They can practice in various health settings, and then you have a certified registered nurse anesthesiast. You must have a bachelor's of science in nursing to have this. So the nurse anesthesiast practice is in many different settings, including hospitals and office settings, labor and delivery units, ophthalmology offices, plastic surgery offices, and many more. Okay, the practice is quite advanced, and they are well compensated for their skills. The medical assistant works as a part of the healthcare team with all of these professionals that we've talked about. Okay, and then you have physician's assistants. Okay, and they are a certified healthcare professional, and they provide diagnostic, therapeutic, and preventative rehab or healthcare services under the supervision of a medical doctor. So they are like an extension of that doctor. Then they must be licensed. Okay, in order to be licensed, and you have to pass the physician assistant national certification exam to practice in any state. So physician assistants may also complete advanced training to focus on a particular specialty, to help narrow that field down for themselves as well. So those are the various types of specialties. There's many, many more, and we just hit on a few, but those are the types of doctors and physicians and other healthcare professionals that you guys can work with and work under, but you can also work in many different settings as well. So there's the hospital settings, okay? And they are the primary level of care. A smaller city, it will have community hospitals, but they can get really up there. So they serve as the first level of contact between the community and the hospital setting. That is the primary level of care. At the secondary level of care, both primary care providers and specialists provide that care. Okay, these are used in more larger or municipal or district hospitals. And then you have a tertiary level of care, which is the third level of care. And it is a referral system. You have medical centers, regional and specialty hospitals. So it all basically depends on how big of a facility you're thinking of. So accreditation is considered one of the highest forms of recognition for the quality of care of the facility and organization providers. And in order to be at a hospital or to use these things, you have to be accredited, or your facility has to be accredited. So there are standards or indicators that have been developed, and they cover everything to make sure that everybody is maintaining their accreditation level. And that is the assessment and care of patients. Are they doing what they need to be doing? Are they using medicine correctly? Are they using plant technology and safety management? Are they being safe about the place? Orientation, education, and training of staff. Is everybody that is employed there trained and certified and educated to work in their job? Are they qualified is the next one. And then the patient rights. Are they being upheld? We'll talk more about patient rights later on. You can have ambulatory care settings. And this is one that medical assistants work the most in. And there's a wide range of walking patients. It serves a wide range of walking patients, from physicians' offices to group practices to multi-specialty practices. Now they could be podiatrists and an orthopedic doctor working together. It's just many different things. A multi-specialty practice might consist of an internal medicine specialist, an oncologist, a family practitioner, and an endocrinologist. Okay, so it's a real variety of medical specialties. Okay, and a lot of these, you'll go see the doctor and you'll refer patients to each other as indicated, and it's convenient, it's more profitable for the group, and it's a good practice. So a patient seeing a physician for the first time is considered a new patient, where a patient has seen the physician over previous occasions is called an established patient. So those are the types of people that we see in those things. So there's different types of ambulatory centers, all right? There's occupational health centers, and those are for patients to return to work after they've been injured or ill, or to return them to a normal level of activity. And then you have freestanding rehabilitation or pain management centers or sleep centers. Okay? Pain management centers help patients deal with discomfort associated with a condition, and sleep centers diagnose and treat people with their sleep problems. Then you have freestanding surgical centers, and those freestanding urgent or emergency care centers provide patients with alternatives to hospitals' emergency departments. Okay, maybe it's a little bit more payment friendly. It gives them another, like I said here, many insurance companies now prefer day surgery because it is more cost effective. So maybe that's a better option than going to the emergency department. Then you have rehabilitation services, and they may be obtained from acute care hospitals, rehabilitation hospitals, or various ambulatory rehabilitation facilities. So that's what they do there. And then you have ambulatory centers that deal with services to patients with severe kidney disorders, or MRIs, or student health clinics, women health centers, and then you get down to the assisted living centers. So the more centers include for the ambulatory center services, more of these include dental clinics, endoscopy centers, community health centers, mobile health centers, and podiatric care centers. Now, the assisted living facilities is an option for geriatric patients or older patients. Okay, many new assisted living facilities are designed specialty for patients with Alzheimer's disease or impaired memory conditions. I've seen this really cool video of this assisted living facility for Alzheimer's patients, and they make it look identical to a city, but it's all within a confined space, so they can go grocery shopping and do all the things that a normal geriatric can do, and it helps them deal with their condition a little bit better. And then there's independent retirement communities offer residents the opportunity to come and go as they please. They may have more of a resort-like a design, catering to the desires of the retirees to enjoy in their golden years. Okay. So here are some other, healthcare facilities. You have diagnostic laboratories. Okay. And now these diagnostic laboratories since they are kind of controlled by the CLIA, or the Clinical Laboratory Improvement Act. Now, since the CLIA in 1967 and its amendments in 1988, many physicians have stopped providing laboratory tests in their offices, so that's why they offer those diagnostic laboratories. This new process is more cost effective according to OSHA and the CLIA regulations. Then you have home health agencies. Now, home health care offers its patients home care, therapy service, administration, and assistance with medications and other services so that the patient can remain at home, yet still get the care that they need. So that is a very good compromise. They get the care they need, but they get to do it in the comfort of their own home. Then you have some medical suppliers and hospice centers. Hospice care involves controlling pain and promoting the best possible life for the patient. Patients involved in hospice usually have a life expectancy of 6 months or less. So it takes a special kind of person to be able to work in that type of setting. And then you have patient-centered medical homes, okay? Or sometimes they're referred to as primary care medical homes. And so it's a way of organizing primary care that emphasizes care and coordination of communication to transform primary care into what patients want it to be. It is one of the most exciting healthcare delivery reforms occurring today, and is saving money by reducing hospital and emergency department visits. Okay? So there are 5 core functions attributed to the patient-centered medical home. Okay, and that's, are they getting comprehensive care? Are they getting what they need? Are they getting patient-centered care? Is it being coordinated with other doctors? Are the services accessible? And is it quality service and safe service? So the Agency of Healthcare Research and Quality, or the AHRQ, which is part of the DHHS, recognizes that health information technology plays a central role in the successful implementation of key features within that medical home. So, with all this, okay, we've learned throughout this lecture that There's many different ranges of medical specialists that we can work with, and different types of facilities that you can work with. But it's important to know your scope of practice. Now, your scope of practice is what you are legally obligated to do. Now, the scope of practice is a range of responsibilities and practice guidelines that determine the boundaries within which a healthcare worker practices. Now, as a medical assistant, you may or may not have a scope of practice as determined by your state, and that's what we're going to find out today. And then you have standards of care, and that is the legal term that refers to whether the level and quality of the patient service provided is the same as what another healthcare worker with a similar training and experience in a similar situation would provide. Okay? So in all, we're going to close up with here patient education. It's important to become familiar with the community resources to make referrals for patients who need them, who need help from various sources. So if you are well educated about the different specialists and facilities, it's a lot easier for you to do your job and to make those proper referrals as needed. If a patient seems to have a need, speak with him or her privately, determine whether an agency or organization could better help with a situation or issue at hand. And patients appreciate the medical assistant's willingness to look for ways to help with when confronted with problems. So if a patient brings a problem to you, go out of your way, go above and beyond to help them, and because that shows that you're really caring for that patient. And the patient-centered medical home model relies on all healthcare workers to participate in the care of their patients. And so, like I said here, I kind of just went into more detail on these 3 bullets here. It says details of healthcare plans. You have to be able to relay information to the patients. Give them the details about what their healthcare plan consists of. You have to help educate them, understand the hospital systems. The way things work. Is it a level 1, a secondary level, or a tertiary level? And what is the way that referrals work? And then it's important to have that constant enthusiasm, like I said, go above and beyond and offer that support to them as well. And then we're going to close up with some legal and ethical issues. So it's important to understand